So today we will talk about growth factors and the maintenance. Means what are the things that needed the bone to grow? First thing, and the second thing is to maintain stability of the growth of the bone, what we need. Okay. So first of all, remember that bone need, what are the requirement of the bone. First thing is requirement. Okay. And the second thing is, after requirement process is completed, bone is strong. Okay. Bone is strong now, healthy. Okay. Because you give what are the requirements of the bone. Okay. Okay. But second thing is to maintain this strongness, to maintain this healthiness, what we need, that is called maintenance. Like one building is there. Okay. First of all, you construct the building. Okay. Then every month there is a maintenance of the building. Okay. So to maintain the building, we need monthly maintenance. So it may be electrical, it may be any physical damage, whatever happen, we have to repair it. So likewise, same thing, our body need maintenance. Okay, let's talk about what are the factors, what are the maintenance the body need or the bone need. First is hereditary. Each person has a genetic potential for height, that is the maximum height, with genes inherited from both parents. Many genes are involved and their interactions are not well understood. Some of these genes are probably those for the enzymes involved in cartilage and bone production. For this, how bones grow. So basically, everyone asks, what is your height? Okay, what's your height and what's your age? Okay, what's your age? What's your height? So basically, why this question arises, because if any person's his father or his mother height is decreased or height is very short, so what happened? The same kind of genes will enter into the baby. Okay, and same height we can see in this baby after become adult. So why this happen? Because of the hereditary, because of the genes which are present in the mother, the genes which are present in the father, both transformed or both travel to the baby. Okay, the same kind of height, same kind of body texture, same kind of body look you can see in that baby after becoming an adult. Okay, so here same thing we have to remember, that the baby's height or babies after become adult, same bone tissue growths are also depend on the gene. Okay, so this is a very important thing we have to remember. Next thing is nutrition. Okay, sometimes your grandfather, your father, your mother, all are tall, but some babies after become an adult, their height can't grow. Why this happening? Their genes are very good. Their father, mother, grandfather, grandmother, both all are tall in their family. But this one person is very short and thin. So second reason behind that the nutrition, whatever the nutrition giving you to a children, it not able to grow his height, grow his body. Okay, like the body needs, what are body are the bone needs, bone needs calcium, bone needs phosphorus, Bone needs protein. Bone needs vitamin D. Bone needs vitamin A, vitamin C. Okay. Without this and other nutritions, bone cannot grow properly. So what are the important nutritions we need? Calcium, phosphorus, okay, vitamin D, okay, vitamin A, vitamin C. So all are needed to get healthy bone. Healthy bone itself having all these nutritions. Calcium is the calcium deficiency. You have the good matrix, but you doesn't have the calcium deposition. So your bone will easily broke. Okay, it doesn't have phosphorus. Phosphorus gives strong bone structure. Vitamin D, which is responsible for the absorption of the calcium. Vitamin D, vitamin A, vitamin C for the matrices, for healthy rods. Okay, when the calcium deposit here. Okay, children who are malnourished grow very slowly and may not reach their genetic potential for height. So, whenever your baby or any patient's baby or any patient is coming to your clinic and asking that my baby is not growing, is not able to grow, his age is 15, his age is 12, his age is 9, but he is looking like a 5 years old baby. His age is 15, he's looking like a 10 years old baby boy. Okay, why this is happening? The second reason behind it, nutrition. The first reason is hereditary. You can tell the patient that her mother, his father having the same genes, so that's the reason he is not able to grow. Second reason is maybe nutritionist. The third growth factor, that is hormones. Endocrine glands produce hormones that stimulate specific effects in certain cells. Several hormones make important contribution to bone growth and maintenance. This include growth hormone, thyroxine, parathyroid hormone, and insulin. So which are the most important hormones in our body, which is able to grow the body or bone or etc. anything. That is growth hormone, GH. Very important. Growth hormone is releasing from the pituitary gland, thyroxine from the thyroid gland, parathyroid hormone near the thyroid gland, and insulin from the pancreas. So we have pituitary, we have thyroid, we have pancreas. PTP is very important. So which is responsible for the growth of the bone, growth of the body, growth of the muscles, growth of the bodies, every part. Okay, which help regulate cell division, protein synthesis, calcium metabolism, energy production. So everything is needed for the cell division. So multiple cells needed to the growth. Okay. Second thing is protein synthesis. Need protein for the strong bonding between the bones, between the cells. Calcium, we need calcium to deposit here. We need energy. Okay. Everything is depend upon all these hormones. The sex hormones, estrogen or testosterone, help bring about the ascension of bone growth, and as well as in the males, testosterone, and the female estrogen need for the ascension of bone growth. So basically, our body needs hormones. This is the summary of the topic. That is, our body needs hormone for growth. So which hormone needs in which time we will talk in endocrinology system. Okay, basically growth hormone is very important. Okay, and insulin. Okay, and thyroxine, parathyroid gland, and testosterone and estrogen. These are the very important for the bone growth. Okay, we have to remember that. Next thing, exercise. Exercise. The hormones and the specific function are listed in 6.1. So here are the 6.1 one table, you can see the hormones and their functions. Exercise. So exercise or stress for bones. Exercise means bearing weight, which is just what bones are specialized to do. Without the stress, which is normal, bones will lose calcium faster than it is replaced. Exercise need not to be strenuous. It can be as simple as the walking involved in everyday activities. Bone that do not get this exercise, such as those of patients confined to bed, will become thinner and more fragile. This condition is discussed further in the box 6.2, osteoporosis. So basically, what is the main purpose of the making of the bone? Why God gave us the bones? For walking, for doing the work, daily work, daily work, daily work. So this is the basic structure you have to do. We have to give our bone daily. So whenever we fail to give the basic stress to the body, to the bone, so it will stop growing, stop going. So basically, you can understood that. So our children's not able to grow. It means we are not allowing to play them, because if they play, more calcium will absorb into the bone matrix. If not allow the children to play, what happens? They will sit down, they will only study every time. The calcium which is deposited into the matrices, it is not utilized by the body. Okay, so there's the reason. In the children's, you are able to see them body pains, neck pain, knee pain, back pain. So why this is happening? They are getting the diseases, fever, okay, every time. Why this is happening? Because we are not allowing to play them. So basically, childrens are allowed to play. So they need to play minimum 3 to 4 hours daily. As a doctor, we have to know about that. So how to grow and how to maintain the body of the children. Okay, so I think you understood. Please kindly improve your knowledge along with this subject and apply to your daily life. Okay, so basically, what is the main things we have to understood in the bone growth? That is, we need four things. One is hereditary, which is comes from the mother and father. The second thing is the nutrition, which is responsible for the bone growth. We have to know calcium, we need phosphorus, okay, we need vitamin D, we need vitamin A, we need vitamin C. Okay. Next thing is hormones. Hormones also responsible for the bone growth. What are the important hormones? We have to remember that main hormones, growth hormone, okay, growth hormone here, insulin, thyroxine, okay, and testosterone, estrogen, and parathyroid hormones. So the hormones responsible for the bone growth. We have to remember. And the last and final thing is we have to give some side of stress to the bones to utilize the calcium, to utilize and absorb the calcium. So whenever we doesn't apply the stress on the bones, the calcium which is deposited on the bone will lose its strongness, and the patient or the person is complaining about the pain. Okay, so we have to remember. So let's talk about these are the important things before we getting to details about the bones. We talked about very important topics that are the function of the bone, skeletal system, types of the bone, what are the types of the bone we have, okay, and compact bone, red bone marrow, yellow bone marrow, okay, spongy bone. And we talk about classification of the bone: long bone, short bone, flat bone, irregular bones. Okay, next we talked about embryonic growth of the bone, how the bone develop and how where from the where it grow. Next we talk about growth factors that affect the bone growth. Okay, now we will talk about here. One box is given, that is fracture and the repair. How the fractures occur and how much time it will take to repair. We have to know about that, because some patient came to a clinic after fell down. He have broken finger. Then what you will do? How you counsel your patient? So these are the important things you have to know. A fracture means the bone has been broken. This is the fracture. This is the bone broken. There are different types of fractures. So we have different types of fractures here given. Simple fracture is here. This is the simple fracture. It doesn't need surgery, or it will take some time to regrow. A compound fracture. This is the compound fracture. Sometimes this needs surgery because of the it's around tissue will damage, nerve damage will happen. So that's the reason it will need sometimes surgery. Green stick. Here we have the green stick fracture. You can see here some stick-like fracture happen. Commuted fracture is very danger, because it will have simple. These types of bones are arranged. Okay, will in thin pieces. Pathology, spontaneous. A bone breaks without appearance trauma may accommodate bone disorders such as osteoporosis. In females, these things happen, that some female have osteoporosis due to the menopause. Okay, they develop osteoporosis. So sometimes they able to walk, they able to lift their body from the chair. They have some fracture. Okay, so why this is happening? Because of the weak bone. So how the healing process and the repair process is happen in the body, you have to know that. Okay, so let's talk about the repairing process. Even a simple fracture involves significant bone damage that must be repaired if the bone is to resume its normal function. So before getting into the normal function, the bone have to be repaired, because if you work in the damage from the damaged bone, your pain will increase, your swelling will increase, and other bones tissues also damage, other tissue also damage. Okay, so that's the reason we have to wait till the bone is improved. Fragments of dead or damaged bone must first be removed. This is accomplished by osteoclast. So basically, whenever the bone fracture occurs, so what the body do? We have osteoclast, we have osteoblast. We osteoclast, what they do? They will eat the damage bones. They will remove the bad damage and dead bones, which dissolve and reabsorb the calcium salts of bone matrix. Imagine a building that has a collapse. The rubble must be removed before reconstruction can take place. This is what the osteoclasts do. So here one example is given. Before improvement, the osteoclasts will remove the dead cells from this area. So likewise, whenever you have to build a new building, you have to clean all the we have to clean all the material from the area. So likewise, our body do same. That is what the osteoclasts do. The new bone must be produced, then afterwards new bone will produce. The inner layer of the periosteum contains osteoblasts. So this is the bone. Okay, in the bone we have periosteum. This is the covering of the bone. In the periosteum we have osteoblast. So whenever we have damaged bone, okay, so osteoblast activate. So here we have the osteoblast, it is activated. Okay, the osteoblasts produce bone matrix to knit the broken ends of the bone together. So what will it will do? It will produce the bone matrix. This is the bone matrix. Example, assume that, so this is your broken bone. Here some pieces are broken. Okay, it will produce bone matrix first, like that. Okay, then bring all the broken bones into one format, because bone has a good blood supply. The repair process is usually relatively rapid, and simple fracture often heals within 6 weeks. So simple fractures take 6 weeks. Some parts of the bones, however, have a poor blood supply, and repair of takes longer. This area are the neck of the femur and the lower third of the tibia. So basically, if the blood supply is more, then you will get nutrition to the blood, then it is able to metabolize or reabsorb the calcium into the matrix area, which is produced by osteoblast. But in some area, in some bones, they are the low blood supply. So then what happen? It will take time, more than normal time. Okay, it will take more than normal, the 6 week to more time, 9 week, 10 week, 12 weeks. Okay, like a fracture of the hip, it will take time, and the lower third of the tibia, it will take time. Okay, other factors that influence repair include the age of the person, general state of health, nutrition. The elderly and those in poor health often have slow healing of fractures. A diet with sufficient calcium, phosphorus, vitamin D, and protein is also important. If any of this nutrition is lacking, bone repair will be slower process. So age factor, nutritions, everything is how to be maintained to bring the bone into normal process. Okay, so these are the things we have to remember whenever a person of the fracture came into your clinic, that you have to ask the questions how you are in, how you are is maintaining your diet, you are taking calcium, phosphorus, vitamin D, protein. Okay, good diet or not, you are doing the exercise or not, how you have the hormonal balance are there or not, hereditary, how your family history is there, everything you have to need to ask the patient. Okay, so here we have the completed the box number 6, which gives the clarity of fracture. Now we will talk about the skeletal systems first, bones. Okay, the bones, we are going to start the topic called bones. In the bones we have the skeletal system. Okay, we have skeletal system, one is axial and another is appendicular system. Appendicular system and axial system, if you assume that this is the body, this is the body na. Okay, this is the body, skull, ribs, vertebral column, everything will come under pelvic bone, under appendicular, sorry, axial skeletal system. Okay, limbs, upper limbs, these are the hands. Hands also called upper limbs. These are the leg. It's also called lower limb. Upper limb, lower limb. Here is the important thing which you have to remember, that UL means whenever you will get the case sheet from the hospital, you will have UL, and LL. LL means lower limb, upper limbs UL. Okay, you have to remember. So let's talk about the skeletal system. The axial system consists of skull, vertebral column, and rib cage. So that's which I am tell you, that skull, ribs, vertebral column in the axial system. The bone of the arms and the legs and the shoulder and pelvic girdles make up the appendicular system. Many bones are connected to the other bones across joints by ligaments. So bones are connected each by the ligaments. Okay, which strong cords or sheets of fibrous connective tissue. They are made up of very strong fiber connective tissue. The importance of ligaments becomes readily apparent when a joint is strained. So whenever you have to you have to, when the joint is there, shoulder joint, you have to spin, you have to throw anything. So only when the ligament is there, so whenever there is a ligament which attach between two bones, then only you able to throw the anything. Okay, with the help of ligament only. A sprain is the stretching or even tearing of the ligaments of the joint, and though the bones are not broken, the joint is weak and unsteady. So whenever you have the sprain, you have the damage of the ligaments, you are not able to lift your hand, but your bone is okay. Why this is happening? Because every bone is attached each another with the ligament. So ligament is necessary for the lifting of your hand, for able to support the other bone. Okay, we do not often think our ligaments, but they are necessary to keep our bones the proper position. Okay, and you have to bear the weight. There are 206 bones in total and complete correctly shown figure 5 6.4. So we have 206 bones. How many bones are there? Basically, when we by birth, after birth, we have mostly 300 bones. After that, an adult has 206 bones. Okay, all bones are fused. Okay, first of all, we will see the bones of our body, then we will talk about each and every bone. Okay, you can see you have to remember the names of the bone which are very very important. This is called skull. What is called? This is called skull, also called cranium. What is the name of this area? Skull. Okay, below the skull, what we have? This area is called, okay, this area, this is the nasal area. Okay, this is the orbital. Okay, orbit. In that we have the eyes. Okay, and you have the zygomatic arc. This is called arc. In the sides of the eye we have zygomatic arc. This is a maxilla. This area is called maxilla. This area is called zygote arc. This is called mandible. When you chew the food, you have these things. Okay, these things. Next we have, this is area is called cervical area. Neck area is called cervical area. Okay, cervical area. This is called sternum bone. Okay, these are the ribs. You can see here, these are the ribs. Okay, this is called collarbone or clavicle bone. This bone is called clavicle bone. Okay, this is the humerus bone. This is called everything here vertebral column. Back of the body, you have vertebral column. Lumbar vertebrae. Middle is called thoracic vertebrae. This is called cervical vertebrae. And this bone is called radius. This is called ulna. Okay, this is called pelvic girdle. All combination. In the, this is called lumbar. This is called sacral area. In the sacrum we have five bones which are fused together. Okay, and we have ilium. Here you have the ilium. Here you have the coccyx. Last tailbone is called coccyx. Okay, this is the coccyx bone. This is called pubis. Pubis area. It is called ischium. This bone is called ischium. This is ilium. In the below we have femur. This is the longest bone of the body. Tibia, fibula, and we have the tarsals, metatarsals, phalanges. Here we have in the head we have carpals, metacarpals, phalanges. So first of all, it's your homework. You have to draw this skeletal single, not combined. Okay, and you have to named every area. Okay, then only you can able to understood the name of this bones. Okay, so you have to remember all the 206 bones names, very very important. Okay, then only we will continue. Here from the skull, we will talk about every bone in detail. Skull. Then we have in the skull we have this much types of bones are there. Okay, so we'll talk about everything, every bones of the skull. Next we have vertebral column. We will talk about vertebral column, how many columns are there, everything back which are helpful in the back pain, shoulder and arm, rib cage. Okay, everything. Okay, hip and the legs, everything. Okay, so first homework I am giving to you that you have to memorize all the names of this skeletal body. It may be axial, it may be perpendicular. Okay, so let's conclude here only. Okay, so tomorrow you have to send the images in the in the app, in the WhatsApp group. Okay, then we continue the lecture. Okay, if you have any doubt, you can ask.